Thank you for your time today, Dr. Jabala. Let's get straight into the virus. So, how much do we know about this COVID-19 virus?
We know that it's the same member of a larger family of these viruses known as coronaviruses. They actually exist everywhere. They spend a lot of their time with animals. So this is a third virus that has crossed. So we have SARS-1, MERS, and now SARS-2. We are beginning a completely uncharted journey with this virus. We don't understand a lot because the behavior is completely different. I was very surprised at the outbreak in China, the numbers of people that were infected in such a relatively small period of time. It's very unusual. This virus is much more aggressive and much more lethal. And for every virus, there is a certain level of lethality. There is a lethal dose. There is how much of this virus you need to have in your lungs before it kills you or before it makes you sick. With this virus, it's not very clear. It's actually very disturbing. There have been some interesting reports that they've had people who were sick and they were cured. They released them out of the hospital and then they got reinfected. The truth is very simple. The assays that we do every day to test this virus, they can only test a certain limit. And if the virus level goes below that threshold, you're not going to detect it. Meaning you're going to release the patient and say you're healthy enough to leave. What I find alarming is we are releasing all these patients, telling them they are virus-free, and they go back to the community. Many people, including me, we start calling it a very mysterious, very cryptic virus because we don't understand it, and it doesn't seem to only attack the lungs. It seems to also attack the heart, and it seems also to attack the liver.
There's so many unknowns about this COVID-19, and China, the Chinese government, is responsible for this lack of information. Do you think this is actually becoming an obstacle for developing a vaccine sooner?
China is not forthcoming with a lot of this information. This information is coming in different bits and pieces, and I think there are some fantastic people around the world that are spending time dissecting that information and putting it together. It's not so much for developing a vaccine, but to study the trajectory of where this virus is going. Right now, we're in the middle of a storm, and a vaccine is not going to help. Even if we have a vaccine today, it's not going to help. I think people don't realize that vaccines don't work for every individual that gets the vaccine. Vaccine is a preventative thing. Vaccine is really helping your immune system to kickstart. Your immune system is really what protecting you. The vaccine is just helping, pointing to the immune system where to go. The information that we're lacking from China is about one individual, patient 0. The case in Italy, the cases in Iran, we have few cases in the United States, especially on the west coast of America.